what are the symptoms? You talked about a little bit earlier, Dr. Zachary. What are the symptoms for someone to think about if they can identify themselves as having athlete's feet?
Early on, we'll cover the three basic. Early on, when you have the more dry skin variety, it tends to be not real itchy, but it looks like it's a flaky change. It almost looks like you have dry skin through the whole bottom of your foot. And people get cream, Lubriderm, Jergens. They get $400 cream from the dermatologist. It doesn't help clear it. And like as soon as I put it on, 5 minutes later, it looks like I did nothing. That's basically we call more like the moccasin foot. That's the scaly type. That's something that's the most common. The other type, that's going to be more just the flaky change in skin. The second will be more interdigital, which we call wet, moist, macerated. That tends to be the one where you start to, between your baby toe and your fifth toe, you start to look, you're like, why is that white? And then you get your sock, you start running between. It feels awesome while you're doing it. After you stop, it exacerbates it, makes it worse.
I've been there before.
Yeah, me too. And the third is more the vesicular type, which is more blistering. That's the least common of the two, but it's the most aggressive because that leads you more to the secondary bacterial infections. You get a lot of breaks in your skin, and that basically pops up, and no one knows why. It just pops up very, very quickly or acutely, and that's the hardest to treat too. So it's more like a red, itchy skin, more of a flaking, but a lot of athletes' feet, everyone thinks it's going to be really, really itchy. Really only between the toes is the itchy variety.
Okay.
So that's what I noticed in practice.
Makes sense.